I'm here to help you understand a lot of the common symptoms that we get this time of year, and we get them in the spring and in the fall. You've got a sore throat, you've got pink eye, you've got cough, you've got a headache, your ears are blocked. I want you to understand the kinds of irritation that create those conditions that then set you up for infection, and to try to help you discern, am I at infection? Do I need something for that? What can I do to treat some of these symptoms? Here we go. So when we look at the illustration here, your frontal, ethmoid, maxillary sinuses connect with your nose with these really tiny passages. So when you're in an area that's got high particulates, when you're breathing in, those particulates will get through the nose just fine, but they get to the sinus and they cause that to swell and slam shut. And that cascade is the beginning of a lot of symptoms. So when the sinus can't drain into the nose, the emergency exit is the postnasal drainage down the back of your throat. Your throat will take that, but it doesn't like it. And it creates the irritation on the back wall of your throat. The mucus then hits the larynx and creates cough. On the way down the back of the throat, it hits the eustachian tube opening, and that's what runs between the middle ear and the back of your throat. So when it does that, it'll create swelling and block the eustachian tube. So then your ears can feel blocked. You're having cough, you're having sore throat, usually more in the morning. And a lot of times at this point, you're having sinus headache. So this series of symptoms all starts right here with blocked sinuses because of the particulates. So your only crime is breathing, but when you're doing that, you're getting irritated constantly with this. And if that fluid builds in the sinuses, that fluid irritates the eustachian tube, that fluid irritates the throat and the larynx long enough, you're going to end up with a sinus infection, an ear infection, a throat infection. It happens. But it begins, even if you get infected, it's really important that you're equally as aggressive treating the blockage and turning off the faucet and stopping the drainage, or you'll get into a series of reinfection. So how do we do that? Your first tools, whenever you feel drip in the back of your throat, or if you don't feel the drip, if you just have sore throat in the morning or you have cough, look on the back wall of your throat. Look in the mirror and say, ah, and look for mucus back here. Look for red bumps. If you see that, that's posterior cobblestoning, that's postnasal drainage, and by definition, even we call it pathognomonic. The only thing that will cause that, if the sinus is blocked, you're going to get postnasal drainage. And it's a really important take-home message is your nose can be wide open and your sinuses can be completely blocked. And that you can see why that is right here. So what is one of the easiest answers to fix this is actually a nasal spray. But the nasal spray has nothing to do with treating your nose. It's the quickest way to get to your sinus passages. So short term, Afrin will open up the sinuses quickly, and it does that within a few hours. But you can only use Afrin for a few days. Flonase is a topical steroid. It decreases the inflammation, opens the lumen of the sinus, and then coats it to decrease your reactivity. So Flonase is like wearing a raincoat in Seattle in the rainy season. Doing that daily during September, October, and then again March, April, are the highest months when we have the highest levels of particulates. That is really going to help to decrease your symptoms. And for those of us that have allergies, it's horrible. But for anybody, you don't have to be allergic to smoke to go into a smoky bar and have it aggravate your sinuses. You don't have to be allergic to dust to have it block your sinuses. So what you need to remember is that if you've got drainage in the back of your throat, if you've got cough, if you've got sore throat in the morning, you got to look for postnasal drainage and sinus blockage. And if you are aggressive and open up your sinuses, and even when you use that spray, it's not just going to open your sinus, it's going to go back here to the eustachian tube and also help open the blockage in your ears. And that is going to help decrease your level of recurrent infection exponentially by about 90%. So how do you know if it's just aggravation or if it's infection? How do you know when you need a strep test? How do you know when you need to have antibiotics? 3 really important things. They're called the Centaur criteria. If you have nighttime fever, and that's documented fever over 101 at night, a lot of times you'll have normal temps during the day, but you'll spike fevers at night. So if you have nighttime fever, if you have swollen anterior cervical lymph nodes, and these guys are right here by the angle of your jaw on your neck, If you poke in there and that's swollen and tender, and you look at your throat and it's fiery red, or it's so sore, not just in the morning, but all the time, or it hurts to swallow, if you've got those three elements, it's likely that you're going to need some help and either a strep test or an antibiotic. That's when it's time to seek a higher level of care. But even if you do that, it doesn't mean you don't do the rest of your maintenance work, because you're continuing to breathe. And every time you breathe, when there's particulates, it's going to irritate you. So it's so important to do both. And understanding where you are on that continuum can really help you short circuit problems before you end up infected. So if you're somebody that's like, oh, I get strep every year at the same time, I'm offering that understanding this physiology that you may not have thought you wanted to know can be really helpful for you. Let us know if you have questions. We're here for you.